Hi Dheeraj, how are you?
I'm
कैसे हैं?
good, sir. How are you?
Great. So we did your surgery around 13, 14 days back.
Correct.
Yeah. So that was a combination of
FUT and
FUT
FUE.
and FUE, and we also did correction where we took out the grafts from your frontal area, and you had very sharp temples also, which you got done 2 years back, 1 year back. When did you get
2 years
this?
back.
2 years back, you got your
June
surgery done.
2018.
June 2018, you got your surgery done. That was again an FUT surgery.
Correct.
And how many grafts were done at that time?
The clinic told me that they have put it around 3,500 grams.
3,500 grafts. So here I have your pictures when you come first to me. This was your condition. As we saw, you had got a transplant done in the frontal area. Very few grafts were done in the crown area.
Correct.
In your first surgery.
Yes.
So this was your condition, and we can see there are a lot of gaps over here, and we can see a lot of cobblestoning, especially these raised things which you see over here. This cobblestoning was also a major issue uh, which you were facing that time, huh? And then you had thinning in the crown area over here.
Correct.
And this was your condition. Okay, that time when you came for PRP. When did we do your PRP? I think
In the month of October.
September, October,
September,
maybe.
October.
Yeah. So this was your scar of first surgery, the FUT which you got done at some other clinic, and this was a pretty decent scar. As we see, there is no, I mean, it is very fine. So they did a good job, like trichophytic closure, and and you have pretty good area. So we included the scar of previous surgery into this, and we took out another FUT. So now we can see you have just now we have removed the stitches.
Yes.
So another important thing, like people are scared of FUT scars, and it is good that you got FUT surgery done earlier, and this time also we did majorly by FUT because we cut this area, we put stitches there, and you end up having a thin fine line at the back of your head, and we get a good number of grafts which are useful and critical. Suppose let's assume that you had before doing this first FUT, let's say this was your area from where they did one FUT, and second FUT we have done this, so almost this much area from your scalp has been excised now. Do you feel difficulty in moving your head or something like this?
No, I don't feel any difficulty. A little bit of tightness.
That is immediately, I mean, for a few weeks that's gonna stay, and numbness also, little bit of numbness also will stay. But yes, you can easily move and do everything.
Yeah, that I am fine with.
So let's say if this is the area from where we did one FUT and second FUT, can we and we have taken out all the grafts which were present in this area. So can we take out all these grafts by FUE alone in 1, 2, or 3 sessions? Suppose what happens? Suppose if we take out all the grafts from this area by FUE, maybe in first session or maybe in 2 sessions or 3 sessions, what will happen? This area will become totally empty.
Correct. The area will be exhausted.
Completely exhausted, no hair, and this much big area with no hair. That means, suppose if there are say 7,000 grafts in this area, and if I opt to do only FUE, then I cannot utilize these grafts completely.
Correct.
And if somebody has already got FUE done from this area, one FUE, then he should never get an FUE done from the same area.
Again.
Understand? Because then it is going to deplete that area completely, and you are creating gaps. While in FUT, as in your case, we have done one FUT and repeated FUT, and still you will have a very thin fine line at the back of your head, and still the elasticity of your scalp is good, very good. Even third FUT surgery can be done in case it is needed. You understand this? So that is the importance of this thing. In your case, we did some extraction also from the frontal area. So this is the extraction which we did from the sides because the angles were like too much of temples, and this area, because you had a lot of gaps, you just now saw the picture of pre-PRP picture.
Correct.
Okay. Now we are seeing the picture which is like post-PRP. So if you see this, it looks better than the pre-picture, pre-PRP picture.
The hair looks a little bit thicker also.
Exactly. And even the crown area, we saw the crown area was that, and now the crown area looks better. So that is what one PRP did to you. You also notice the changes after PRP?
Yes, I feel that.
You have got these PRP sessions done at the previous center also,
Yes.
but did you find any difference between the two?
Yeah, there is a difference between because earlier when I got my PRP done, at that time I was not able to see that much difference. Now, if I got my PRP done in the month of October, I can see the difference in the pictures also.
Yes.
Because the hair looks a little bit thicker and the gaps is also
Exactly.
small.
Now coming to your intra picture, actually, which I clicked at that time with my phone. I think it should be here. Yeah. So now this is the real scenario. I'm sorry, there is little blood clot, but yeah, at the time of your surgery, we clicked this. So after your first surgery, you were put on finasteride.
Yes.
1 mg per day you were taking it.
1 mg per day for 1 year.
1 year. So what was your like? How did you see the result and how was it developing?
The results were good. I showed you the video also. Because at that time when I was taking finasteride and minoxidil, both the things, so the hair looks a little bit denser also and thicker also.
Exactly.
But once I left the finasteride and minoxidil, then again I've been facing the same problem. Like the hair looks very thin and the gap is very high.
Exactly. So at the time of doing surgery or booking your surgery, did they advise you that about what advices were given you for maintenance, like before the surgery? Did they tell you anything?
No, they did not tell me anything. Actually, I got my consultation done on a video call because I went to different state. I told
Okay.
you about that. So I went to different states. So I got my consultation done on a video call, and they told me that this much graft that you needed. So I went there, stayed there for 2 days, and then the surgery was done. So at that time, they did not inform me that I have to take this medicine or this solution for lifetime. Because after 1 year, when I went to that doctor told me that you can continue finasteride.
You can or you have to.
You have to continue finasteride, and there is no side effect for that.
But
But after reading on Google, so I myself left that tablet.
so you were kind of happy for a month, for a year or so.
For an year, I was very happy.
You were happy.
Very excited.
You got very good results and
Correct,
everything. So see, this is what is happening.
And people were appreciating me also in that year because in the first year I got a very good result, and people were appreciating me also that the hair looks very good, it looks very natural, everything. But now for the last 6 to 7 months I've been facing this problem.
When you stop this finasteride, after I guess stopping of finasteride, maybe after 3 months, you must have noticed a significant reduction in density and
I thought that I should continue again because I was facing the problem, and then again the confidence, then my self confidence is going down.
So this is what I'm exactly telling my patients that see a lot of results which you are watching on internet, people are showing that these results are because of finasteride. So you had miniaturized hair even in this area. We all have miniaturized hair. You must have heard that females who use minoxidil, they grow hair on their forehead. Okay, so we have miniaturized hair. Minoxidil or finasteride can increase the thickness of these hair. So this is what happened to you even in this area. Now this is the real status of your transplant where we can see the gaps. There are a lot of gaps here where the grafts were planted. We can see these are your own hair. These are your own hair. This is the area where grafts were planted over this portion, over here and here. So there were gaps there. As you can see, there are no hair in between. So, but the miniaturized hair which were present in this area, they got thicker. And even in the transplanted region, you were seeing better results because of finasteride. Now, secondly, what happened? These hair which are there, your original hair, they became very thick because of finasteride. I have shown you many videos. I told you also many cases of mine also where I did So see, now the problem is, clinics don't tell you this. They say, okay, you have to take this, or maybe sometimes they tell it after the transplant, and then I am not against this medicine. This medicine is good. Finasteride is good. Those people who have not seen this, I mean, you might have seen my video on finasteride also. Yes. So, see, finasteride, the reason why I don't give this medicine to all of my patients, and that too not at 1 mg per day dosage, is one side effect, but that is a minor reason. The major reason is tolerance. So see, minoxidil, if you keep on using, you stop minoxidil also, or you were continuing minoxidil?
I was continuing minoxidil, but after the PRP I stopped.
Yeah. So even after stopping minoxidil, we noticed there was significant improvement in the thickness of your hair, even after stopping minoxidil. But when you were continuing minoxidil and you stopped finasteride, you know what part finasteride was playing and what part minoxidil was playing. So that means finasteride was playing the major part. Yeah, that is the major thing.
The major thing is that finasteride is playing around 80% and minoxidil is only 20%.
Exactly. So those people who see transplant results, you also must have gone to the clinic after seeing their results. But now you know the results which are being shown on internet, they are not actual results. Correct. A lot is because of medicine, and then the number of grafts also. Yeah.
More than 90% of the result because of finasteride.
Exactly.
Now I had an experience, and I had an experience of good FUT procedure also, and that too I have done because I have researched also at that time. Because I have to go to FUT, that's why I went to that.
You went to some different state also.
Yeah, different state also, and that doctor. After the surgery also, I was very happy that I have done the FUT surgery. But now I have seen that all the results, credit goes to finasteride.
So this is actually what's happening. I have seen people committing 4,000 grafts, 5,000 grafts, and doing surgeries and then giving finasteride and saying that we have done that to FUE alone. Just imagine FUE alone, and then claiming that grade 6, grade 7 we have filled. But if you remove finasteride from it, then what is the result? Then the real result will come. But the thing is, uh, you are not a trophy for me. You are a human being, and you have some, what do you call, you have some emotions attached to your transplant. You would like to sustain your results as long as possible. According to me, this is cheating when we do this.
Because this is a very sensitive issue. People got attracted to videos and marketing mimic and marketing gimmick very easily.
So, what sort of marketing gimmick you think you fell for?
Because when I was searching for this procedure also, so I saw a video of that doctor, and there are so many videos for FET procedure. So I thought that the doctor is good, and there could be possibility the doctor is good, but he is not aware because everyone is not aware of everything.
Exactly.
So he was not making videos about minoxidils and finasteride and everything. He was just showing the result, that what is the result that his client is getting. So for that, I got attracted to that.
Okay. Now, if we see this, the transplanted hair are at gaps. Now, this is the real situation of your transplant, because these hairs they may thin out. But did you notice any thinning of your transplanted hair also?
Yes, yes.
So that is also very important, because I always highlight this point that even transplanted hair can thin out. Although people believe that transplanted hair have no DHT receptors, they will remain as it is. I am telling you with my experience. See, I did my eyebrow transplant, and these hair which I took from the back of my head, 6 years back I did some grafting in my eyebrow. So they used to grow at a very fast pace. They used to grow. I used to cut them every week, but then they acquired the characteristics of recipient site, and now they grow at a slower pace, and they have thinned out also. They are trying to resemble their recipient site. This is called phenomenon of recipient dominance. So even the transplanted hair tend to acquire feature characteristics of recipient site, and that is why we see thinning of transplanted hair, and you saw it in
Yes, yes,
1.5 years.
Now I have experience because earlier I also read it on the website, and So many people have said that their transplanted hair are permanent, but now I have experienced because I got my transplant done and then again there is a need of transplant.
Exactly. So now we have since done this, and right now I'm seeing you. We extracted these grafts from this because hairline was too low and it was like pretty sharp. So, what do you feel about this hairline, and what do you feel about the? Do you really think the number of grafts which you got done were
I don't
that
think
many?
so because at that time one person has done the whole procedure. I had experience of that, and now I have seen here that he told me that we have to go for 2500 FUT and 500 FUT, and there are so many people around me that who is doing the procedure, and that too it will take took around 8 to 9 hours. And where I got my transplant done in the month of June 2018. So at that time, only one person has done the surgery, and they told me they have put 3,500 grafts.
So just now you met a person outside who was like we did 4,000 grafts for
Yes,
him.
yes,
It
yes.
was done on 2 days with the whole team, and it was a combination surgery, FUT and FUE. So did you notice like the kind of filling he had on
Yes,
his
yes,
scalp?
yes. It looks very natural and normal.
So that is the real number of grafts. And for smaller areas, for very small areas, one should be very careful. The purpose of making this video, and thanks a lot. You are cooperating, and is to educate people that and either you learn from your own bad experience or you learn from an honest doctor's experience, provided the doctor is ready to share the experience with you.
Correct.
So what do
People
you
has to aware of everything because it's a we can say that the thing is very sensitive. The hair
exactly
is very sensitive. If
exactly
you love your hair, it is just like a self love and it increases the self confidence also. So people has to aware of this thing, and I would suggest everyone that visit your clinic first and take a consultation first, and then they can decide.
because we are born with a limited donor, and people come to me after spoiling their donor completely. Sometimes people get FUE surgery done and entire thing is gone. I'm not against FUE. See, I have done myself FUE surgery.
There are so many videos on the YouTube that the people are promoting FUE surgery, but people has to understand that what is the difference between FUT and FUE.
And see, sooner or
Because it
later,
is not like that if you have gone for one transplant that you don't need the transplant in the future. You have to get it done again.
you have to save your donor. And if somebody is saying that we will do only FUE or we will do only FUT, then that is incomplete solution.
Right.
And sooner or later, one has to resort to FUE or FUT both. If we do only one type of surgery, suppose if I do only FUT, then what about these here? We can use these here, but that for that I need to do FUE. So if I'm doing only FUE, then if the area is damaged, no matter how much one has damaged the area, even from the most damaged area, still we can extract some FUT. Still we can give some hope and some hair to our patients.
Yeah, because nowadays maximum number of people are doing FU because FU will give the good result, but the thing is that they are just taking the client one time. They are not thinking that what the client will think after 2 years or 3 years.
Exactly. That is the thing which I want to highlight because, see, I think there is a rat race of what you call giving maximum number of grafts and flashing it on internet and showing, oh my goodness, I give that density, and people get mesmerized. The reason why I'm making these videos, and it takes a lot of effort. I really appreciate your
That's okay. Thank you so
inputs.
much.
Yeah, but you know what happens? Even if you can do say 4,000 grafts in this area or 5,000 grafts in this area, it is not necessary that your donor allows us to take that many. So 99% of the cases are being done in this way only, telling numbers like 3,500, 4,000, 5,000, and making food. Then second is, even if your donor allows us to take that many, should we put that many in one go? And see, if you put the hair too dense, and if you thin out, then again then we need more donor and we don't have any donor.
Correct.
And you go to the same clinic again and again, FUE, and one fine day they'll destroy everything and then they'll say, oh my goodness, I cannot do anything now, it's done. So that is the reason why I initially did not understand why my practice has turned into mostly repair transplant practice, because a lot of people were coming with this kind of thing. But now, see, it is very important and it is a message for all of you who are watching this video that there are three things: medicine, PRP, and transplant. And all these three things have to be used cautiously. If you introduce all the medicines in one go, that will be good for the commercial interest of clinic. You know, the clinic will be very happy because you'll be happy, and will make fool of many people then. But it is going to hit you hard. So use the medicines cautiously. Then second, PRP. I have seen this mad race, people doing 6, 7, 10, 8 PRPs post transplant, which does not make any sense. If you don't know about it, go through my PRP videos, you will understand the concept of PRP. And then thirdly, even if I can do say 4,000, 5,000 grafts in your case, but that needs effort, that needs combination techniques. It cannot be done by just FUE alone or FUT alone.
Yes.
Okay, so in case we do that, then it is a I'm going to get more money because I'm doing more number of grafts. I'm going to get more fame because I'll be showing the result and I'll be getting instant result to show everywhere.
But that is for shorter period of time.
Yes, but people don't realize this. If we are doing this, we are here for you. Everything we are doing, everything we are earning, it's just because of you. And it is your interest which I should keep in mind rather than putting me up front, rather than think all the time thinking about me, my clinic, my marketing, and the way I think I project. And another problem is people get misguided and they also think, oh, it happened in this case. Oh, grade 7 can be covered with FUE. Arey, wow, very good. Baba, I'll get it done.
People expect the same thing from the others.
And one more fact, everybody does not have same kind of donor.
Correct.
And patient with thin, and sometimes you know what, people show the donor area and they say, oh, look at this donor, we took out that many, and even now that is one out of millions which you are showing.
Every person donor area is different.
Is not same. Anyway, Dheeraj, since we have done this repair now, we'll be reviewing your case after some time, and now see, because you have consumed finasteride once a day, daily for such a long period, even now I am starting just minoxidil. I am not starting finasteride at this moment. Okay, so we'll keep it at hold. Maybe we might need to add it to prolong the results later on. As of now, I'm not doing any PRP. Hold back PRP also for a good period of time because it induces tolerance. So I don't want to lose such an important ally of mine, which is so handy. Okay, so all I'm giving you is biotin, minoxidil, and that too on alternate days. Okay, so use minoxidil on alternate days. Take this capsule. Take this. This is vitamin B12, and take this zinc tablet. Okay, so that's all. Plus, you can use this ketoconazole shampoo for dandruff, which you might face. Clean it with this, so the scabs will go, and then that's it. Use this, and you see me after a week. Then we'll be doing this thing for you, huh? Okay.
Thank you so much.
Thank you, Dheeraj. Take care,
Thank you.
please.
Thank you.